For some of you, you might know him already, but if you don't, this is Dr. Diego Ponce. Dr. Diego Ponce is from La Ceiba. He's been in Roatan multiple times over the years and has seen a lot of patients here. And he's one of the people I count on as part of my team to help keep me healthy, especially with my eyes. And we met from some simple stuff, and then I had cataracts building because that's going to happen to you at a certain age. He's done 2 surgeries for me, and my eyes are perfect. I'd like to say that the one thing you said that I didn't expect, and is now I have to use readers, because you said as soon as I get surgery, my nearsightedness is going to disappear completely, and it did. So now I'm stuck using readers, but I see clearly, and the colors are great. So welcome to the show.
So, good afternoon. Thank you, Keith, for having me today in your show. You better say that you're doing good with
I'm
your
doing
surgery.
great. I'm doing great. I can tell you the worst thing for me was, as a painter or as a writer or as a guy who uses his eyes for video, was losing the color. I wasn't able to see things. And once I had the cataract surgery, it was pretty amazing because everything came back in a vivid way. That's really changes your attitude. I mean, I think, they talk about people that live in cold weather climates where the sun goes down and it's down for a long time, and they get depressed. I would like to, I don't know if there's ever been a study done, but I would almost believe that as the eyes start to fade and the colors become less vibrant, it destroys the quality of life and probably makes people depressed a little bit.
Well, yes. In your case and the most case of people that have cataracts developing inside their eyes, the contrast sensitivity is the first thing that is affected, since the crystalline lens should be almost transparent. Light should go through it without any obstacle. But in the case of the cataract, the rays of the light, the UV and UVB rays, do not cross completely the cataract and do not reflect on the retina as they should. So people start seeing that the contrast is different. They see that the colors are different, and they perceive that they are seeing with less acuity in low light conditions. So basically, those are the first symptoms. Then people start seeing 100% blurry. And that's actually why it's called a cataract, because people start manifesting that they see everything as if they were seeing it through a waterfall, hence the name cataract. So yes, we can exactly explain the benefits of this type of surgery, as in your case that you saw that the color intensity and the color, the brilliance of everything definitely change. And it's due to that, because when we do that type of surgery, we introduce a artificial lens, which is called a intraocular lens. It's a PMMA lens, which is a type of plastic, a high quality type of plastic that is inside the eye that redirects whatever we see, the images, the sun rays, everything that we are seeing, it directs it straight to the macula, which is the most important part of the eye and the retina. And that is why people recover all of that contrast and that intensity of the colors.
I also want to add that driving at night is difficult on this island because it's not very well lit. And as people start to have this take place, it becomes dangerous to have them behind a car, especially after sunset, because the color is not there. There are no lights on the roads, and people tend to walk on the roads here, and it makes for a bad situation. But anyway, that's gone. So again, thank you for that. Let's talk about eye health. What are some of the most common mistakes people make when it comes to their eye health, Dr. Ponce?
Okay, so the first mistake that everyone does, not only in eye care and eye health is auto medication. People go into the pharmacy and buy whatever the people who's over the counter is telling you what to buy without a proper exam. And that is the cause of a lot of complications in the long term, because most of the time the pharmaceutical person who's selling you the drop does not know most of the side effects that can cause really serious damage to the eye health. Another common mistake is going first to the optics just to do new glasses instead of going first to the ophthalmologist and then to the optometrist, so you can have a proper fitted lens. So people start the other way around. They start from the optics and the pharmacy before going to the ophthalmologist.
Is this because people generally are afraid to go to the doctor? They kind of want to solve the problem themselves?
Yes, I think there's a DIY, do-it-yourself culture, and we feel self-sufficient. But in this case, most of people go wrong with those type of decisions. I cannot assure if this is a problem, but some people think that going straight to the doctor, they feel that it will be more expensive than going to these other type of options, and usually it's the other way around, because if you do things wrong, you have to start all over again, as you have to begin a new treatment when you already spent a lot of money going the other way around. So I think there's a lot of stigma inflicted in all this situation, and people always try to hear what they want. So when they go to the optometrist, yes, your glasses, you're okay. So that's what they want to hear. Maybe some people do not want to hear bad news, or some people do not want to hear that they need surgery because they're scared of it. But as you know, it's a really fluent surgery if it's a cataract, and there's no harm or huge issue in the routine cases.
No, the recovery time is literally you're ready to go the next day. Physically, you can't go and if you're an athlete, you got to wait for about a month and a half until you're checked out by you, the doctor, and everything gives you the green light because you're still in a situation where you're vulnerable. But after that, everything's great. I mean, I can say the first time I hit a golf ball after I had the cataract surgery and I could see it, it was a good thing. All right, how often should people get an eye exam, even if they're healthy?
Okay, I hope you made a hole-in-one after the surgery.
I'm working on it.
So the normal eye exams should be, for example, newborns should have their first eye exam before 1 year of age. After that, the next exam should be before going to school, because usually it's the age where people should detect refractive problems. What are refractive problems? The need to use glasses to read far or near. Okay, that's the ideal age to detect myopia, hyperopia, or astigmatism. Later on in adult life, maybe between 20 and 25 years is a great age also to have a routine checkup. And later on, the ideal age is to have a checkup at 40 years old. Why? Because at 40, the eye has some structural changes that are involved with the eye pressure, with the appearance of presbyopia, which is the decrease of the near vision. And afterwards, if people have other types of past medical history like diabetes, hypertension, high cholesterol, blood levels, they should always have a fundus eye exam to rule out any type of diseases that can affect the retina. And later on at 60 years, and if the person does not have any type of risk factors, we could repeat this exam every 5 to 4 years. If the person is 100% healthy, we can direct it to every individual. But those are the ages that people should have routine eye care.
There are people, I read about this all the time when it comes to, quote, epidemics. There is an epidemic of diabetes.
Yeah.
This is a common condition now. In the United States, it's estimated that 60+% of people are overweight. I mean, obese. And that lends itself to diabetes. Okay. I don't know that weight problems have a problem with eyes or they're interrelated, but it would seem to me if you're borderline diabetic, you should see a doctor about your eyes.
Yes, that is exactly true. When the guidelines say that when a person is diagnosed with diabetes, type 2 or type 1 diabetes, the patient should have an obligatory ophthalmology routine checkup. Why? Because at that moment when the person is diagnosed with diabetes, it means that about 10 to 5 years before, the blood sugar has been high or borderline. So in that time, we can detect the appearance of diabetic retinopathy, which is the leading cause of preventable vision loss in working age adults. This is serious because the people who suffer from this are working age. They are the workforce of each country. And as you said, and as you mentioned, that the percentage of obesity and diabetes are super high all around the world, not only in the US. A lot of people go blind in their working ages. So that means that they are probably a father, a mother who has a family to take care of, and they cannot go to work because they are going blind. So that is a huge economic and social burden for the family and for the community. So the ideal thing is for a person who is recently diagnosed with diabetes to have a checkup, and then later on each year. So we can treat diabetic retinopathy in its early stages. Why? Because when the stages are in mild or severe or proliferative, or there's bleeding inside the eye, the visual prognosis is low. The treatment is very expensive. The treatment is not guarantee of recovery of vision. And let's not mention if the patient evolves into a retinal detachment due to diabetes, it's a very complicated situation. So that will affect the visual health of the individual in a severe way, and it will not recover as people think it would, because there's a huge misconcept that surgery resolves everything. And actually, us in the medical field, we prefer to use surgery as the last resort. We do not want to do surgery, and we try to prevent that stage always. So doing laser, doing routine checkups, Avastin injections, and having a good glucose levels, we can prevent the appearance of this disease.
Are there everyday habits that can improve your eyes and harm your eyes?
Yes. So the food, we are what we eat. That's the first habit. First habit, always have healthy foods, natural foods, non-processed foods, foods that do not have a high level of glucose or sodium. That is very important. Antioxidant foods like vegetables are really good for eye health. Other type of routine things that people usually do are staring into a computer for a long time, a long period of time. And it's not that the computer is going to make you blind. It's that since we are staring so much into a screen, we have a lot of screen time and we unconsciously stop blinking, and that increases the rate of dry eye.
What are warning signs that somebody should see a specialist like you right off the bat, immediately? You've got to go now.
So that is a very wide question. If we can directly, specifically to retinal issues, which is my subspecialty in the retina area, the warning signs are floaters. Floaters are the first sign of a vitreous detachment, and that can also be the first sign of a retinal detachment. In retina, the retinal detachment is the worst thing that can happen to an eye. And when the vitreous, which is the gel-like structure that's inside the eye, which is normally attached to the retina, starts forming some traction, it can tear the retina and detach it completely. So when people start seeing those floaters, it's mandatory to have a fundus eye exam to check the retina and see if there's any type of tears or any type of traction in any part. Another warning sign is pain, blurry vision, and specifically sudden onset blurry vision, because gradual blurry vision could be because of a cataract, because of defective glasses, but sudden onset of visual loss is extremely important and it should be addressed immediately, even when patients do not have past medical history. Okay? So it's always important to have those types of signs in mind when we are thinking about our eye health.
I didn't know that about the floaters. I had always been told, it's no big deal. It's part of getting older.
No, yes, it's actually, that's one of the things we check when we see patients over 40. We also always have to see the optic nerve, the macula, the retina, to see if the vitreous is causing some type of damage in any part of those areas. So that's why I mentioned that specifically at those ages, we have to do that routine checkup. Why? Because the vitreous detachment process starts between 40 and 50 years in some people. So in those type of exams, we can see if there is any type of damage.
Now, you mentioned screen time. Is screen time really as bad as a lot of people that you read in the media say it is?
So there are a lot of myths, there are a lot of studies, there are a lot of realities. So let's start with the myths. Right now, a lot of people always ask me, this is an everyday question. If my kid or my husband or my wife starts seeing the cell phone for uh 5 or 4 hours a day, they will go blind. No, you will not go blind due to screens. Screens do not make people blind. The issue with screens is that there's a complex system which connects the eye to the brain. And that system is governed by the blue spectrum of light. Okay, light is composed by different colors, and specifically the blue light in the light that comes from the screens stimulates some parts of the brain which alter the circadian rhythm. What is that? The sleep rhythm that we have. Normally, our brain is set that when it starts going dark, you start to feel sleepy because that's your normal type of process, chemical process inside the brain. So this blue light affects and inhibits that type of response in the brain to tell you have to go to sleep. Okay? It's a hormonal and chemical balance that is affected due to the screen, the light from the screen. That is why if you see in your iPhone or your Samsung that there's a blue light blocking filter, or that glasses always bring a blue light blocking filter, that is to block these type of light waves that affect this type of circadian rhythm inside the brain and the eye. So it has also been linked to a specific disease in the eye, which is called the age-related macular degeneration. It's a complex system inside the macula in the central part of the retina, which blue light makes a connection specifically in the macula and the fovea, where the most of the photoreceptors absorb that blue light. So a lot of studies have been researching how much that blue wave affects these photoreceptors. There is no conclusive data whatsoever at this moment, but there is some suspicion that this blue light can cause some increased stress on the photoreceptors, which could lead to overworking of the photoreceptors and eventually cause age-related macular degeneration. But I have to be completely clear, it is not confirmed yet. There are multiple studies that have been going on for decades and it has not been proved yet. But there is a physiological explanation to that. Another thing that people ask me is my kid, will he go blind by using the cell phone? No, he will not go blind. What could happen is that his myopia could be stimulated. Why? What is myopia? Nearsighted. When people are focusing in the near vision, the eye tends to grow towards the back, and that increases the myopia. Myopia is the negative number when we put to the glasses. And in some cultures, as the Asian cultures, it's a habit to read, it's a habit to be in front of a computer almost all the time. Since early ages, there's a high incidence of myopia. So the real epidemic is right now the myopia, and there is a direct relationship between screen time and the advance of myopia. That is not a myth. That is something that is a epidemic since computers and tablets appeared. But it also happens when you read. If you read when you're a kid for about 4 to 6 hours with a very near book to your eyes or your face, you're doing the same stimulus. The difference is that the iPhones, I don't care if they're Apple or Samsung, doesn't matter. They are actually addictive. So they spend even more time in the tablets, and that stimulates the myopia.
Okay, so you're a surgeon, and I've been in your facility. It's state of the art. You have great equipment. And you and I are technical people, and we like to see what the latest is. What are the advancements you're seeing in eye surgery that have you excited?
So I'm excited about the gene therapy. Gene therapy, specifically in retina, there are millions of advances in ophthalmology, but gene therapy is important because it's a type of treatment that is injected directly into the retina, and it can modify some autoimmune and some inherited diseases that to the date, as we speak, do not have any type of treatment, and that is a technology that's being developed really fast. I want to mention that ophthalmology in the past 2 decades is the specialty that has had the most advancement in technology and in research. And my grandfather was also an ophthalmologist. My mom is also, and they are impressed that when they were in the residency, they would never imagine that now we have tomographies that measure microns. They do not, they are always amazed that we can do retinal surgery and we're working directly in a live retina. And the cataract surgery has advanced incredibly in the last 10 years due to increased quality in intraocular lens, lasers. Glaucoma treatment is a really wide array of options that we have now. Back in the day, there was only drops and one type of surgery. Now we have stents. Now we have surgeries, valves, lasers. We have everything now for glaucoma treatment. And in the retina field, there's also a good advancement in intraocular injections with anti-angiogenic type of medications that treat diabetic retinopathy, macular edema, and age-related macular degeneration in its wet stage. And it's a promising area because a lot of people go blind due to those two last diseases, which are most of the common diseases that we see in retina.
Living on Roatan presents itself with a lot of sunlight, and a lot of people are out all the time. Are there anything, suggestions, ideas that you might pass on to the audience about protecting their eyes in this environment on the water?
Okay, perfect. So I know you like golfing. I know you like to go fishing. I know you're always on a boat or on the beach. So in those type of conditions, we have a lot of light, sunlight, intense sunlight, which also reflects from the beach, from the sand, and from the water. That goes directly to your eyes. So the first thing is to wear a good pair of sunglasses. Not expensive, good. And what does good mean? With a good UVB and UVA filter. Okay? They do not have to be of expensive or fancy brand. They could be anything, but as long as they have the filter, they work okay. I always recommend them to be polarized because that blocks a lot of the reflections from the road, from the water, and from the sand, and that makes your eyesight a lot more comfortable. People should always use a hat because that can also affect the skin of your eyes. If you can see that in the Caribbean places, we have a lot of incidents of pterygiums. Pterygiums are that type of skin that starts covering the eye, and that's completely caused due to intense sunlight. I always recommend people to use a good sunscreen because the skin is not in the eye, but a lot of dermatologic cancers can affect the eye. So I always encourage people always to use their minimum SPF 40 or SPF 50 when they're in the sunlight. And basically that's it. And usually a lot of people always have the habit to use lubricant drops, which is really good because in these type of environments, there's a lot of dust, a lot of sand, a lot of sunlight, and that causes also some type of dry eye.
Is there any particular type of drop? I mean, where would I get that? Would I go to the pharmacy? Do I pick up a generic drop at the store? Or which one? Do you have any ideas?
So I don't know if I can mention any type of brands because I don't want to mention specifically one, but I will mention the compounds. Sodium hyaluronato de sodio, which is sodium hyaluronate to 0.5%, is the ideal drop. There's a lot of brands. In Honduras, we have almost 20 brands of lubricant drops. And inside those, there are some without preservant components and other do have preservatives. I would always recommend preservative-free drops. Why? Because that type of chemical can cause some irritation in the skin, and I always recommend without preservative components inside the drop, and that can make the drop more natural. And those you can buy over the counter. Back in the States, you can buy in Walmart, in Target, wherever. You can buy them. Just go to a shelf and buy whichever you want. But the best one are those that has those type of components.
Well, listen, I want to say thank you very much for coming on with us. For those of you who are watching, Dr. Ponce will be on the island next week, the 25th. So it'll be great to have him here. And if you get to know him, you can tell what kind of guy he's. A nice guy. He's really smart. Really cares about what he does. He's interested in it, and he's got a deserved reputation for being as good a surgeon as you would hear me say he is. So anyway, thank you, Dr. Ponce.
Thank you, Keith. Nice always speaking to you. Thank you for having me in your well-known program. And Yes, you you have all your history in the island, and it's a privilege to me to have been participating with you. And thank you for the option to talking. And it's a pleasure for me always to educate people because prevention is always the best treatment.